Hi, I'm Dr. Fauley, and we're at Care Animal Clinic in the surgery room, actually, and I was going to talk to you about spaying and neutering our pets, cats and dogs. It's something that we do routinely here. Probably one of the more important things that you can do as far as responsible pet ownership goes. Those two procedures are probably the most common types of surgeries that are done here as well as in general in veterinary medicine. We do it for the community clients here in the area as well as for some of the humane societies and animal welfare leagues. They will bring theirs in and we'll help them out by trying to do this so that things can be controlled and we're not we're trying to do a responsible thing as far as the neighborhood and the regional pet population is. Spaying is for female dogs and cats. It's a spay. Technically it's called an ovarial hysterectomy, where the ovaries as well as the uterus are removed. In male dogs it's called neutering, and it's just where the testicles are removed. It's in and out the same day here. You drop them off in the morning, you hold them off of food the night before, you drop them off in the morning, we do the procedure, we do some pre-anesthetic blood work. Then, as long as that's okay, we go ahead and sedate them, get them prepped out in the prep area, and then bring them in. And this is the surgery room. And then we have this is a trough that, especially for bigger dogs and cats, we'll use it too. They're laid in this, and we have a towel over it, so it stays. So we want to make sure that they stay, warm and that temperature isn't an issue or anything like that. So we put a towel down, a heating pad, we put them in here, and then this is where we do the surgery. They're monitored by a couple different ways. We always have an assistant in here watching things and adjusting things and working with the anesthesia machine, but we also have a monitor here that checks a number of different parameters. These are EKG leads, and these leads are hooked up onto the limbs, and so we're able to get a constant flow of the heart rate, rhythm, the beats, and so we can know exactly what's going on with the heart while they're anesthetized, while we're going through the surgery. So if anything happens, we're alerted right away, and we can follow that along very closely. These other wires, which I'm not going to get out everything, there's a temperature probe lead that we can attach, and we know exactly how warm the animal is, so we're able to follow their temperature. There's an oxygen saturation monitor lead that also attaches to here. And what that does is it tells us how much oxygen is flowing through the pet's veins and arteries while they're anesthetized. So we want to make sure that they're breathing enough, and that this anesthesia machine is delivering enough oxygen, is the animal's breathing well enough to keep things well oxygenated for them, because that's going to be one of the more important things that we're going to want to know about while doing surgery. So they're monitored. We have them on anesthesia, and the most advanced anesthesia is sevoflurane, which we have in here for veterinary medicine. The sevoflurane, which we have here, the safest. Once you get them sedated, once you turn it off, they seem to wake up right away. So you're really able. You're really able to control the depth of anesthesia well. We have a whole shelves of surgical instruments for doing things such as other things other than the routine spays and neuters. We'll do abdominal surgery, or we've had to pin broken legs before. We've had to remove growths and tumors, or animals that just come in from fights, or maybe they've gotten traumatized or something. The tail got caught in a door, or some of the even worse types of traumatic things, and so we're able to kind of get them in here and address those issues also. So that's kind of in general the surgery, but like I said, the common things are spaying and neutering. They go home the same day. Okay, they're dropped off. We do the surgery, then we let them go home that same day. 2 weeks later, they come in and we have the sutures removed. Any questions? We always call the next day. If you have any questions, we give you our number here as well as a home number to call if you notice anything or have any questions about it. That's what's done. We usually do it at 6 months old, but it can be done at any age. And the sooner you do it, the better. It's always the safest. But if something happens and it just needs to be done, well, we just do what we